My name is Michael Rochester, and I would like to discuss health psychology in America. Psychology in medicine. I would like to discuss the topic of health psychology. I chose this topic to better understand the importance of mental health services within medicine and to promote awareness about the state of our medical system as a whole. Health psychologists are the missing link within the primary care system in America. This inadequate accessibility to behavioral health services is leading to the deterioration of human health and well-being. Health psychology is the study of the psychological and behavioral processes in health, illness, and healthcare. Understanding the basics of behavioral health psychology will highlight the importance of this philosophy within the medical field. The implementation of knowledge from this profession will improve the understanding of mental illness and chronic disease management in the population. Why is the role of health psychologists so important? Why are they needed in the U.S. healthcare system? The biomedical model and its limitations. Stedman's Medical Dictionary found the biomedical model to be a conceptual model of illness that excludes psychological and social factors and includes only biologic factors in an attempt to understand a person's medical illness or disorder. The standard medical model that is widespread in the West has been successful in many ways. Without the model's triumphs, physicians would lack the basic understandings of the tools needed to combat infectious disease. The acceptance of Louis Pasteur's germ theory of disease and the biomedical model allowed for things like antibiotics and proper sanitation to come about. Without this advancement in awareness, it may have taken much longer for them to become mainstream. The medical model has improved and advanced the way physical care has been provided throughout the years, but recently it has become evident that this model has its shortcomings. Chronic disease. Bennett found, while infectious disease was the leading cause of death in 1900, today most Americans die of chronic diseases like heart disease, cancer, chronic lower respiratory diseases, and stroke. A patient's behavior should be taken into consideration when diagnosing illness and prescribing steps to regulate and prevent disease. Many times, physical illnesses manifest because of diseases of the mind, something that health psychologists are able to help with. Chronic disease management cannot be improved unless the underlying issues are addressed, one of these being poor lifestyle choices. A different approach. Pruitt comments, most of the problems presenting in primary care clinics cannot adequately be addressed from an exclusively biomedical framework. Chronic illnesses, somatic symptoms, and health-threatening behaviors are common and indicate the need for a more comprehensive approach to care. Standardized medicine receives more funding and attention while only focusing on pharmaceutical intervention and physical recommendation changes to treat disease. If health psychologists were allowed more ground within our system, they could address long-term disease and lifestyle choice issues from a different angle, focusing more on stress management and the rewiring of the brain through meditation and counseling would help diminish negative thinking patterns that in the long run lead to habitual disability and disease. Health specialists. Pruitt explains, behavioral medicine specialists also address health-related behaviors such as smoking, physical inactivity, noncompliance, anesthetic dependence, and inappropriate use of medical services. They have knowledge of basic physiology, medical terminology, and medical conditions in their treatments. These types of professionals have what we need to treat all types of disorders. Unhealthy lifestyle choices that eventually lead to chronic illness are being ignored and untreated by regular primary care doctors. A patient's physical ailments may be deep-rooted and intertwined with mental behaviors. Anxiety, depression, and obsessive thoughts can lead to serious and crippling diseases of the body. Regular medical physicians are completely underqualified and unprepared to offer reliable forms of help in these situations. There should be a balance between the varying spectrums of physical and mental health within our medical model. Health psychologists could offer the ideology needed to create a system that works for all areas of disease. Where are health psychologists needed the most? A medicine plus behavioral model in primary care. Pruitt has noted, a medicine plus behavioral model would move psychologists from isolated referral settings to the front line of medical care, where a broader impact on the outcomes and costs of healthcare could be achieved. It is becoming clear that health psychologists are needed in the primary care sector now more than ever. The medical care system in America desperately needs rewiring to effectively care for the needs of the public. An ideal system would do away with the one-sided approach and incorporate a clinical psychologist's services into the office setting. For suffering individuals, this would bring the best of both worlds together. A treatment would consist of a detailed examination of both mental and physical health, without the need for any outpatient visits. If both types of doctors were available in the same environment, this would make things much easier for the patient. Not only would diagnosis be quicker, but the setup would also reduce any degradation associated with visiting a mental health professional. To reach optimal improvement, it is also important to address healthcare costs. As of present, they are steadily rising every year. A new system that encompasses a behavioral ideology may allow for a change in the escalating U.S. healthcare expenditure. It is well known that the biomedical model's attention to diagnostic testing and biologic interventions is contributing to the increase in healthcare spending. Bringing the focus away from pharmacology could reduce the price tag while improving the population's health with alternative processes. Rural areas. In the words of researchers Milan and Worth, over the past 2 decades, the rural healthcare infrastructure has been significantly eroded because many rural hospitals have closed or have switched to a critical care mode that only provides emergency services. Of all the areas in America that are lacking adequate mental health services, data shows that the rural areas of the country are being hit the hardest. In sections of the U.S. where there is a low population density, there is an increase in suicide, substance abuse, and mental health disorders. Through research polls and surveys, it has been made evident that healthcare providers within the behavioral health fields are lacking in non-urban areas, contributing to the rise in these negative behaviors. America's healthcare system still places health psychologists behind the veil of the specialty clinic, only available through referral from a primary care manager. The literature shows that because of this, upon graduating, health psychologists gravitate towards a more urban setting. A push towards a more integrated system where psychologists and physicians work together would improve the scope of medical intervention, improving the life of many rural dwellers. Who can benefit from the services provided by health psychologists? Veterans. Griffith stated, over the last decade, numerous studies have investigated the risks associated with deployment and having participated in combat operations on the physical and mental well-being of soldiers. There is a strong correlation between the support systems of combat zone veterans and a positive mental and physical state upon homecoming. Deployed military service members, like the individuals who make up the Army National Guard, are subject to environmental distress as well as mental strain while overseas. Data shows an increase in the negative effects of military combat exposure and post-deployment stressors. Links associated with the deterioration of the service member's cognitive health state and continued military operations make support like behavioral mental health services paramount. The prolonged exposure to environmental emergency and anguish among service members can increase the risk of negative emotions and loss of relationships. The data shows the correlation between positive support systems such as counselors and family units and a soldier's recovery. Health psychologists could reduce the increased rates of depression, anxiety, and alcoholism that is evident in returning troops. Their involvement within the primary care system would benefit veterans by offering easy access to mental health services. People suffering from chronic disease. Pruitt found the biomedical model's failure to adequately address mental health concerns is one of its major limitations. Many believe that the mind-body dualism of the U.S. healthcare system is one component of its escalating healthcare costs. When patients' mental health concerns go unaddressed or are inappropriately treated, healthcare costs rise in a never-ending effort to identify the biologic defect underlying the patient's complaints. The process of undermining mental health concerns is extremely detrimental to individuals suffering from chronic illness. Instead of utilizing a wider spectrum available through a medical plus behavioral model, people are subject to the guessing game. Individuals suffering from anxiety and depression may develop physical symptoms due to the ailments of the mind. Coping strategies and positive outcomes cannot become evident through a system that only focuses on diagnostics. Health psychologists are needed to better understand and implement these changes that will reverse or improve mental health issues. Many individuals who are chronically ill would be much improved if they had access to a mental health specialist who could guide them to effectively coping with these problems. Mental illness does not discriminate. Werner Cohen understands, while the need to address mental health issues has been recognized, there still exist significant gaps between need and treatment of mental illness. Unmet need is defined as a condition in which a person has symptoms of mental illness but does not receive services. The gaps that are apparent in America's healthcare system are a big problem for many different types of people. Mental illness does not discriminate, and its effects can be devastating to men, women, children of all different races and backgrounds. A system that includes educated professionals like health psychologists will benefit the American people as a whole.